Hello, anatomy colleagues. This is Dr. Alsup, and in this session, we are going to focus on the arteries we want to be able to identify in the cranial cavity and brain session. So we're going to focus on an inferior view of the brain for this discussion because it really affords the best view of these structures. So let's get started. I hope we remember that the brain is supplied by two main arterial sources, and the vertebral arteries, which are a branch of the subclavian artery, are one of these. And so you can see the two vertebral arteries right here on this image. I'm going to outline both. And these vertebral arteries are closely associated with the medulla oblongata. And it's not uncommon for the caliber or the size between the right and the left to vary, as we can see very clearly here on this donor, that we have one that's quite a bit larger. These vertebral arteries will traverse the foramen magnum, and there is one branch of the vertebral artery we want you to be able to identify, which is the posterior inferior cerebellar arteries. And we lovingly abbreviate this to pica. Sometimes you'll hear people say pica, but I think pica is the way to go. So you can see these coming off transversely, but before the vertebral arteries coalesce to form the basilar artery. So the pica also has a very close relationship to the accessory nerve, as it ascends from the spinal cord up through the foramen magnum. Okay, let's focus on the basilar artery now, and this is formed by the coalescence of those vertebral arteries that we saw in the previous image, and it is going to run down the midline of the pons. This artery is named because of its close relationship with the cranial base, so the basilar artery. And there are three branches of the basilar artery that we want you to be able to identify. The most proximal of these, and the smallest, is going to be the anterior inferior cerebellar artery. So very close in terms of name to the pica, but we're adding an anterior. So often you hear this abbreviated as ICA. And this is, as mentioned, typically smaller, certainly smaller than the pica. It will often form an anastomosis with the pica, or the posterior inferior. It's also closely associated with the abducens nerve, which you can see right here. Next, we have the superior cerebellar artery, which you can see nicely on this side, and the posterior cerebral artery. So right here is going to be the superior cerebellar, and this will be the posterior cerebral. And these are going to be the two kind of terminal branches. And before we move on from the basilar, I do want to point out that you do have a cranial nerve that I'm circling right there, which is cranial nerve 3, or the oculomotor, that is located between the superior cerebellar and the posterior cerebral artery. So if you have some form of aneurysm or occlusion or something that causes an increase in size of these arteries, it could cause compression of the oculomotor nerve, which would have implications in terms of the movements of the extraocular eye muscles. The other main arterial supplier to the brain is the internal carotid artery, or the ICA. This artery and its branches will be a major supplier to the forebrain. And when you're looking at this view of the brain, the internal carotid artery had to be cut in order to remove the brain. So what you will often see are these fairly large cut portions, so fairly large in terms of caliber, for the internal carotid artery. And there are going to be two paired terminal branches of the ICA. The largest, and what almost looks like a continuation of the ICA, are the middle cerebral arteries. And so these are going to be, as mentioned, the largest. These will be located kind of running towards and within the lateral fissure on the brain, so it's often easiest to see the middle cerebral when you have retracted the temporal lobes in order to better view these. The smaller terminal branches, which I'm outlining right now, are the anterior cerebral arteries. And these are going to be connected by this very small anterior communicating artery, which I just drew an arrow to. So you can just see, I'm outlining right there how small this artery actually is. And then the anterior communicating arteries will continue more anteriorly, as its name would suggest, and actually runs through the longitudinal cerebral fissure region. You can see that it has this really close relationship to the optic chiasm region. So it's kind of running anterior to the optic chiasm. The last branch of the internal carotid we want you to identify is another small communicating or connecting artery, which is the posterior communicating artery. So you can see posterior communicating arteries coming off of the ICA, and this is will actually connect to the posterior cerebral artery, which recall was one of the terminal branches of the basilar. So this is where you're getting that connection between the ICA and the vertebro-basilar system. And lastly, I want to just walk through the cerebral arterial circle, which we will most typically hear referred to as the circle of Willis. And this is composed of branches that we've already discussed and identified, but I just want to review these in the general area, as this is such a clinically important area. So, the circle of Willis is this prominent anastomosis on the inferior portion of the brain of branches of the ICA as well as the basilar artery. And the circle will surround the infundibulum or pituitary stalk of the pituitary gland, as well as the optic chiasm, which are going to be more medial to the circle of Willis. So you can see it kind of surrounding that region. It is going to be composed of the anterior cerebral arteries, connected by the ever so small anterior communicating artery. So that's where you're getting communication from the different branches of the ICA. And then posteriorly, you have that posterior communicating artery that is attaching or connecting the ICA. Sometimes it'll connect the middle cerebral, but typically the more typical pattern is ICA to the posterior cerebral artery. And remember that posterior cerebral, and it will do so on both sides, that posterior cerebral artery is a terminal branch of the basilar, so that is, this posterior communicating is how you're getting a connection between the ICA and the vertebro-basilar system. Excellent. So I believe that is about as much fun as we can have with arteries of the brain. It has been fun finally getting to see the internal carotid artery have some branches, unlike what we saw when we were dissecting the neck. As always, if after you review and you find areas of confusion, please always feel free to contact me or any of my anatomy colleagues with questions. Have a great rest of your day.